Hi guys, so today we'll talk about the drugs used to manage ischemic heart disease. What is ischemic? Inadequate or partial of blood supply to any organ of the body. When it happens to the heart, it is called a cardiac ischemic. What is angina? The most common and frequent patients complain of IHT. Angina is due to temporary imbalance myocardial. What is infarction? Permanent stop of blood supply to any organ of the body. When it happens to the heart, it is called myocardium. Myocardial infarction results to death of heart muscles. What are the risk factors? Obesity, high blood cholesterol, physical inactivity, smoking, age, gender, family history, and hypertension. What is stroke? Paralysis of usually one side, sometimes both sides of the body, due to the brain cell damage. Stroke is the second commonest cause of death in most countries of the world after myocardial infarction. It can be caused by two mechanisms: ischemic strokes, inadequate blood supply due to blocking brain blood vessels. Hemorrhagic stroke results spontaneous rupture of blood vessels, leads to leakage of blood to brain tissues. Stroke is the commonest cause of disability in elderly. Stroke can also lead to sudden death, so stroke is treatable and preventable. Aim of anti-anginal treatment. First, reduces the pain as soon as possible. Because if there is no pain, there is no damage to the heart muscles. Secondly, reduce the frequency of attack with long-acting NO3. Third is prevention. Example, aspirin is low dose aspirin. Main anginal drug groups are nitrates, beta blockers, calcium channel blockers, antiplatelet drugs, potassium channel activator. Glyceryl trinitrate is drug of choice for acute angina, a life-saving drug. The most effective treatment to reduce the symptoms is all NO3 are vasodilators. So venodilation, arteriodilation, and coronary artery dilation. Side effects are difficulty in breathing, dizziness and fainting, swelling of the eyes, ears, and inside the nose, nausea and vomiting, headache, coma, seizures, change in heart rate, excessive sweating, flushing, severe chest pain, blurred vision, pale and clammy skin. Dosage forms of nitrates: short-acting NO3, a sublingual tablet 0.5 mg or 500 microgram, or buccal spray. Long-acting NO3 is transdermal patches, which onset is 1.3 hours, duration is up to 24 hours. So used to manage nocturnal angina, sustained release tablets. Injection for IV use is acute severe angina 50 mg in 10 ml vial. Dispensing instructions. While you're in dispensing tablets for them, you should always educate about their disease, what their disease is actually. You should educate them. Keep sublingual as possible and allow to dissolve. You should actually keep this tablet. You all have to teach them where you have to keep them, and you have to tell them that to let them allow to dissolve. Don't wait till the pain becomes worse. Dose may repeat within 5 minutes. If there is further relief is required, you can repeat it, but the maximum dose is 2 milligrams, so which is 4 tablets. Educate about the side effects and the precautions. Educate signs of the overdose. Instructions about storage about GTN, which is glyceryl trinitrate. They should be stored in amber colored bottle in cool place below 25 Celsius. To ensure potency with airtight container, close the bottle cap tightly after the use. Don't transfer to plastic container. Avoid the contact with PVC, plastic, rubber and cellulose. Educate how to identify the expired tablets, which means if the tablet is expired, they should know how to identify it. So identifying that it is there'll be a vinegar smell and tiny crystals. Don't use 8 weeks of don't use a tablet after 8 weeks of the first opening. Educate how to identify fresh tablets, as they produce a slight burning sensation when placed under the tongue. Long acting NO3, used for treatment and prophylaxis of angina, also used in heart failure. Nature of NO3 decides duration of action and administration route according to solubility. Isosobite dinitrate, indications is SE, side effect same as GTN, dosage form as tablet 10 milligram. For immediate action, tablets can be taken as sublingual. ISDN should be given in asymmetrical dosing intervals. Isosobite mononitrate, ISMN, indications say and the side effects are same as GTN. Dosage forms are 10 milligram, 30 milligram and 60 milligram. So that's it for today. I hope you all found this information very useful. If you all found it useful, please do like, subscribe and share my YouTube channel, and please do hit a thumbs up button under this video. Thank you so much.